The latest research that's out there tells you that a lot of people who have had a concussion but can pass the neurocognitive piece, the questionnaire piece, are plagued with long-term dizziness. A lot of people have headaches, sleep disturbances, and again, the most recent study I've heard of in the last 2 weeks talks about even at 6 months when some of those symptoms are starting to subside, they still have chronic balance problems. The average person sees between 4 and 5 medical providers before they get to the right person. There's two parts of that I think that concerns me. One is the cost. I mean, the cost of that is big. Two, I think that there's a much better way, and I think that physical therapy and our recognition of concussive TBI vestibular problems addresses that problem acutely. There's no better place for you to start than physical therapy. If you've been to the ER and they're not worried about serious trauma to the brain, meaning a bleed or something that is life-threatening, and which is the majority of concussions are not, that getting the right diagnosis early and getting the right intervention early prevents all those problems that we know are associated with post-concussive syndrome. If you go past your 2-week window and you haven't addressed vestibular integration, as they call it, or good physical therapy intervention early, you become much more susceptible to that post-concussive syndrome that involves chronic headaches, chronic dizziness, chronic nausea type problems, chronic balance issues. We can get those early, but the average person, the study just published, says the average person with those symptoms, and it's not a life-threatening, so your CT looks good, your MRI looks good, your doc says, I've looked in your ears, that looks relatively okay, I'm not quite sure what we're dealing with. Those people see between 4 and 5 medical providers before they get to the right person. And I like to think at HDPT, you're in the right place, and if we can't completely help you, we work as a team at HDPT. We work with neuropsych, we work a lot with vision, we work with some great physiatrists, neurologists, and we'll make sure you get to where you need to go. Sure. So concussion issues are, in the last 5 years, have really become prevalent through the NFL, through the NHL, through college, women's sports. We're starting to recognize injuries to the brain are serious. So, seeing a primary care ER doc, urgent care, is critical because it will rule out the really bad things that can happen as a result of taking a blow to the head. However, after that, there's been a slow dispersal of information about what works well. And again, there hasn't been a ton of great outcome studies on it yet. They're starting to come. But it tells you that the old myth about going into a room and laying in a dark room and staying there with your headaches and everything else is actually the wrong thing to do. And so probably from what was standard 10 years ago to what is standard now and should be on the cutting edge, it's taken a while to filter through the medical system. And I think, people ended up in a variety of places. If you had problems with your ears, you maybe ended up in audiology. If you had problem with your vision, you ended up with vision people. If you had headaches, you ended up with neurology. If you had balance problems, you maybe got the OT/PT. Some of that, we see a tremendous amount of referrals from speech because it's a motor function associated with your brain and hearing and all those other things. So you ended up in speech. And so I think what we see now, certainly in our practice, is working with all those professions. Everybody was treating a piece of it. And what we're seeing now is that you can really help those problems early by getting the right early intervention so you don't develop speech problems, you don't develop chronic hearing, vision, dizzy problems. And Early intervention, frankly, is seeing somebody like HDPT where you evaluate vision, balance, all those other things associated with a concussion.